So how are we going to go out and serve up the information you need to make a decision? Because at the end of the day, people have to weigh up the risk of whatever they're going to do. I mean, at the end of the day, that's just reality. And humans are horrific at typically, kind of on a large scale assessing it per se. But it's like, again, as long as they have the right tools in their hands, that's what our goal has got to be to, like, whether you're an actual HCP that's communicating, whether you're in industry communicating, or whether you're on social media, it doesn't matter. Like, we all really need to get better at, that sort of bringing it down a notch and making it one-to-one, make it feel one-to-one. It might not be, right? You might not actually be in front of somebody on a social media post, but how do you make someone feel like that is a one-to-one interaction for them? Because I think healthcare in general has lost a bit of a personal feeling to it. But even in industry, we feel we're getting farther away as well, whether it's legislation or it's, whatever barriers are kind of getting put in the way. But the reality of it is, again, I don't know if we're going to touch on this later, but like, this is where I'm saying technology like AI is going to help us, because I think that we're bogged down in bureaucracy, we're bogged down in administrative work, and we share this in both industry and healthcare. Like, we have the same pain. I actually looked at a chart with, like, what's the day in the life of a healthcare professional, and I was like, oh, that looks like my day, actually. It's kind of like emails here and admin here, and maybe I'll have time to have lunch and learn. And, so it's like, we're not so different in that regard. And so it's like, I think the technology piece is going to help us to get rid of that stuff and make us be human again. So we can be human as the interaction as a healthcare professional with a patient, and humans in industry to say, we can now actually get what our HCPs need. If they really need something quickly or in a different way, we can start to do what we want to and be more creative. So I think this is really kind of like, I think, where it's going and where we need to go.
Yeah. I mean, the only thing I would add back in terms of the AI portion as well is that I feel like some people, and I saw a post, just as we were getting ready to log in, I saw a post on LinkedIn about people that send out direct messages every single day using AI, and on LinkedIn. And the whole idea of sort of, I don't know, just flooding everybody with communication that is, I mean, I kind of think about it like some of the things that we wind up eating that are bad for us, right? It's a similar sort of thing. It's like, look, if you're going to give me all of these, kind of Twinkie posts that, essentially have no caloric benefit to me whatsoever, I'm just going to ignore you, I'm just going to move on. And, so the goal isn't like volume.
Correct. It's quality.
Right. And I kind of see that whenever I see people, thinking, hey, look, if I just send out 1,000 messages a day, I'll eventually hit somebody. Well, if you send out 1,000 messages that are not personalized, you don't know me, I don't know you, most likely I'm going to ignore you anyway. So it's one of those things where communication, empathy, and a little bit of understanding, I guess, need to kind of come together, to be able to deliver that. And I kind of think, from the HCP standpoint as well, right? Even if AI could help them sift through everything, it's making sure that it sifts through in the right way, that they can still use their mind, still be empathetic to their patients, still engage, et cetera.
Yeah. No, and I think you're right, because I think everyone's out there like, oh, let's deploy AI, but there's so many wrong use cases. The one you just gave is a very bad use case, right? The good use case is, again, AI is great at saying, here's the data you have. Now I need to set an algorithm for this type of HCP, and I can predict that this is how this HCP is in, taking information, or this is where they are on the prescribing journey, whatever this looks like. You can now, like you said, that personalization, that's where AI is powerful, because we also have biases. When I look at, the data that's in front of me, I could sit there and go, well, I want to do whatever makes my team look like it's doing a good job. Or maybe I'm not really good at that type of communication, so I'm going to kind of ignore that giant data point. But AI, it's a truth maker, right? It says you can't lie anymore. I mean, you can still massage numbers, don't get me wrong, but like, there's some level of like, it can help you in a lot of cases to say, here's what's really going on. Here's what you need to actually focus on. And then you can use, again, different multimodal models to do all these different things. When you mindfully say, I'm going to build this, and you have a clear use case in mind, But like you said, sometimes that doesn't happen. And this is also what's stressing out HCPs, right? Everyone said, okay, for all these, different systems that they're going to be locking all of their patient information in, let's just use AI, or let's make it all electronic. No HCP was involved in the building of it. It's created more burden for them, more stress, and it's not been fit in properly into their workflow. And this is the biggest mistake you can make with AI. So doctors can tell you what would help them. So why do you not ask them? And it's the same for us in the industry. We know what our pain points are. Don't tell me I want to use this type of AI when I know what my problem is and it could use something different. So these are the things. I think you made a really good point. It's like there are bad use cases. And then there's definitely things that if you do it more mindfully will be truly impactful.
For sure. Yeah. Michelle, what inspires you?
I have to say, now that I'm working with Unbiased, I think for me, my inspiration really is that I want to do whatever I can with the skills that, I've been given, and work with the fantastic people like my business partner, Jess, to be able to go out there and make a difference. And you could get depressed and say, oh, no matter what I do, it's never going to be enough. But kind of that also keeps me going. So I'm like, no matter what I do, it's never going to be enough. And that's okay. It's like, keeps you going. It's like, can I get more creative? Can I enjoy this more? Can I work with even more cool people? I mean, that's the thing, Jess and I think a lot of people we're finding will work with us because we're like, let's just try. Like, what's the worst that can happen? I think that's the amazing part. So that's what really, I think, drives me at the moment is, as a nurse, I really felt like I was making a difference. In MedInfo, I really feel like I'm making a difference. And now with what I'm doing in this space, it's even bigger. I'm helping in even more spaces, which is really exciting.
Thank you for sharing that. What concerns you?
Well, I definitely think misinformation and disinformation, but I also think this erosion of trust. Industry, we've never had the luxury per se in the past couple of decades of trust, which is unfortunate. And I think there are some of us really trying to build that because there are a lot of people that are working really hard to keep drugs safe and to do the studies to show that we can cure certain rare diseases and we can help people manage diseases. But my concern is definitely between the public and the governments and, between science and pseudoscience. I mean, that definitely concerns me because at the end of the day, again, it goes back to what drives me is I don't want people harmed by these things. And unfortunately, what you see is the outcome is definitely not for the net benefit, unfortunately, when you have that much conflict and lack of trust. And so, again, it goes back into my inspiration is that's what I got to keep working on. And I know that Jess is in the same boat with me. We're like, let's bridge build. Let's help people understand a bit more and maybe show each other a little more grace, right? I think this would be that would be really nice. That would be my dream.
Yeah, absolutely. And last question, what excites you?
I love science. I love medicine. I know, I when I went into, work in the surgical sales, I never realized I was like, I don't like sales. I like sales. I don't mind sales now. But back then I was like, I don't like sales, but I was like, I love medicine. And I was like, this is my calling. And I think I loved when I was working as a nurse. I loved what I did. And I love that I still can help, support all my healthcare professional colleagues and can work in so many ways. But I really love medicine. I think it's, for me, it's something that just really excites me and it's always developing and evolving. And it's just so incredible to me. The human body is incredible, but also, what we do, whether you're healthcare professionals or industry and scientists, we're all making a difference in that. And there's something really incredible about that every single day.
Yeah, absolutely. Well, Michelle, thank you so much for being on the Life Science Success podcast and for telling us about Unbiased Science. Where can people check out the podcast and also where can they find out more about Unbiased Science?
So we have a website that you can kind of start at, but we're on Instagram. You can find us on Unbiased Science SciPod. You can find us, on Facebook, on Threads. We are on TikTok and the other groups, but I think our biggest ones are definitely the Meta platforms. Our podcast you can find it in all of the, app stores that you're able to get your podcasts. And we also have a Substack. And I think a lot of people also, again, really enjoy the Substack. So we're really kind of everywhere, depending on how you like to learn, as we said, how you like to digest information. We're definitely there. And, really kudos to Jess for all that she's done, to date. I'm just really proud to be a part of it.
Oh, very good.